And I've seen people too who are very weak when their libido is very weak. After detox, they tell you they're strong as a bull.
A woman has been taking herbal detox every month for about 2 years now, and she believes that it cleanses her blood. But now she's experiencing stomach discomfort, occasional dizziness. What would be your approach to her case?
Well, first of all, we have to look at what she's taking. I don't know what kind of medicine or herbal medicine. Is it herbal she's
Yes,
taking?
herbal.
Yeah. So I don't know what kind she's taking. If she was taking a blood cleanser, and unless that herbs have something else to do, some sort of side effects which are very rare. Most herbs do not carry side effects so much.
Okay.
But if she's taking a blood cleanser and that blood cleanser have a side effect, maybe that's the situation. And then there are other situations you have to look into. Sometimes it's not the herbs itself that causes her to have problem after taking, you said, every month.
Yeah.
So is she taking in the week during the month, or is month by month by month?
Month by month.
By month by month.
Once.
Yeah. So it may not have anything to do with the herbs at all.
Okay.
Because while one is taking herbal medicine, for example, if you're drinking, you're smoking, or if you're eating bad food while you're taking blood cleanser, it will only help one side or another. But it depends on which side is overburdened. We don't know why she's feeling stomach problem.
Okay.
But it could be several other reasons other than the herbs. Or if it's the herbs, then it must be a particular herb that will have some side effect that will give her some stomach problem.
Okay.
But then you have to look at her overall, a complete general situation to see if while she's taking every month, saying she's cleaning the blood, taking a blood cleanser, is she eating heavy food late in the night and then going to bed and sleep? Which can produce ulcer, then she's having a problem. Also, is she eating an excess amount of fried food, burnt oil like, frito, these kind of oil, which are oftentimes, serious kind of a backlash, whiplash. Sometimes it can cause her to have it. I don't know where she's feeling the pain, but she could be having appendicitis as well. So there could be several other things that you have to look at, other than the fact that the person is drinking or taking some form of blood cleanser, but practicing some very dangerous or bad health habit, hazardous to her life. It started to happen. It can start happening like that. And there are other things, so you can look at other issues as well. If she is cleaning and there is certain, like for instance, say, fecal matter inside the stomach,
Okay.
and the herbs get to that point where it's trying to clean that, it could send her stomach problem. And she might think to herself that, she's having this suffering coming from, from the herbs itself. But it could be that the herbs is trying to remove certain stuff. So for example, there are times when I give a detox, and the same detox is given to no less than 100, 200 people. Same thing. Same capsule, same liquid. And some people will complain and tell you that it gripes, like it gripes them. Well, others may tell you no, they didn't feel anything like griping, except it sends them to the toilet very often and they flush a lot. Well, why did it, the same herbs, given to many different people. Why did it gripe some people and others it did not do that? It's because some people are impacted with fecal matter.
Okay.
And the herbs is trying to push that out. They feel that and they cry out that it's hurt or something. Well, yes, it's discomfort, but it's just good for them. But as I said, it's hard for me to say because one, I don't know what kind of herb she's taking. Two, I don't know her situation. I've never seen her really. I would have to do a complete assessment to know, oh, she's loaded with fecal matter or she's not. So you have, as we spoke about that before, where we have mild, moderate, severe constipation. Well, maybe she could be severe constipated. Maybe she could moderate, she could be mild. I don't know. But it could be one thing or the other. Now, if you ask me how would I approach it, this is why I said oftentimes in our clinic, we don't approach detox like most other people do.
Okay.
We do it differently. First of all, we give something that is very mild and secure to go through from your drink it through your mouth, esophagus, stomach, small intestine, large intestine. It runs through it. But that kind of mild detox is to follow by a stronger and a more aggressive detox. And when I use the word strong and aggressive, I don't mean it's supposed to harm or hurt anyone because I use those two words. It is just to say that what the first one did not do, even though it did a lot, the second one is to go in after the first one, soften up the fecal matter and flush out what it could flush out, and then at the same time started to penetrate the fecal matter that is sucking or holding onto the colon wall. This one will go in now and uproot that, and you will see these different color: black, red, heavy dark color stuff coming out. That is how it's supposed to follow. But some folks too, and that's another reason why, as I said, I don't know why she's feeling that. Some folks try to put in heavy dose one time, and the person go through this, the body goes through shock, trying to just do what it never did in just a few nights or a few days. It's trying to let out what it never did for years. So she could be feeling pain, but that's how we approach it. We do that.
Oh, okay.
And in so doing, we clean heart, liver, lungs, kidney, gallbladder. You could say all the endocrine system, including, like as I said, the liver, which is oftentimes loaded with toxin.
How do you know you have detoxed properly?
Well, there are several ways to know if you are detoxed properly. One, from the beginning of time, before you start a detox, it is best for you to do quite a few things. You can do it, urine tests. You can do a hair analysis.
Okay.
And you can also do a blood test. Now, when you do that kind of test before you start a detox, it can tell you a whole lot, like a lot of what is going on in your body. For example, it can tell you that the blood is very unclean. And it can tell you too if too much uric acid is in the body. And it can also tell you how low or how high certain minerals are and certain vitamins are. So whether they are too much of one, too low for the other. And oftentimes this is because certain of the organs that are supposed to handle these things, especially pancreas, liver, and all that, they are not working well because too much pressure is on them, too much toxicity is on them. So when you do this test and you look at it, it will show you, what is going wrong in the body. Then you can go on a detox. And if you're using the right thing while you're detoxing, for example, vitamins, minerals, amino acid, whether it's right enzymes, and so on and so forth, including the proper herbs and all that, it will put it not just detoxing you. When it's cleaning you up, it's putting back the right amounts of mineral, the right amount of vitamins, the right amount of mineral, all of these things going back in the body. So when you go back after you do the detox and you do a blood test again, you can see the wide range difference in result than when before you start. Even if you don't do the test, you can tell that you had detox if you did a good detox. A good detox will be like this. Before you do it, you eat and you will feel like your stomach bloated. You're not digesting food properly. If you're a woman, you will realize that when your cycle comes for the month, you should check and you look at the period, you will see dark clumps and all that in it. You're supposed to see this bright red, not dark sludge. And even too, you will realize that the odor, it smells. You said odor nuisance. It doesn't smell good. You will also realize when you use that, not just women alone, as for men too, they will realize when they use the toilet, it smells very bad. You will realize for both male and female, when you urinate, the color doesn't look too good. It looks grayish, sometimes dark red, like the color is just off. But when you do the detox, you will realize, one, before you even do the detox, let's talk about a little bit about that too. Your breathing, not too good. When you're sleeping at night, you snore like hell. When you get up to walk, you find you start to go all over the place. Your equilibrium is off. Your balance is out. If you look at other part of your body, it will be telling you that you need to detox because you will realize you're having pimples everywhere. If if you don't stop, it will go further where you start to have boils. Then if you don't pay attention, then you start to have big sores. It's called leaky gut syndrome. It starts to spill over inside, coming out through the large intestine, small intestine, and ending up in the bloodstream. And then now it goes all over the body. You're having sore everywhere. You might realize you're having anxiety. You might feel like you are depressed. All this is coming from the fact that you could be loaded with fecal matter, and these things are throwing off toxin in the body, hampering all the organs them from working properly. And then the organs are sending off wrong signal, different signal all over the body, which is not supposed to do. You're not sleeping very well is another one. I just gave a lady a detox. She came in because it's so bad that they brought her in and they're saying that they think she's losing her mind. And they said the next one is that she's not sleeping well. She seems like they think she's losing her mind. When they go for her in the morning, she works in the field too. And they said she just can't get up and she's having all kind of problems. Just the detox alone, they give me one call. Dr. P, hey, I just have to call you and let you know she's sleeping well. I'm like, that she just started a day ago. They said, yeah. The next day we went, she sleeps like a baby. And then they're saying that she's not talking sound and sound anymore. Like, I'm like, oh, well, let's see how that will work. So you will realize that after you go through all this detox, if you, while you're doing the detox, do go to bed and rest at night. That means proper rest. If while you're doing the detox, you drink enough water. If while you're doing the detox, you are temperate in all things. If while you're doing the detox, you get exercise, proper exercise, and proper amount of water, you're putting it in the body. The nutrition level is proper while you're doing the detox. Because if while you're doing a detox, all these things has not been practiced, it is obvious that you're going to have a serious problem, even you go on detox. So if the proper thing has been done, including other things, you're getting proper air, sunshine, and all these things, exercise, yeah, by the time you go through it, you will know, even without going to the doctor, that, you feel better, you're sleeping better, you're breathing better. At night time, you will realize you don't snore. People wonder, so how or what does detox have to do with you snoring? Well, I can explain it. The thing which is at the back of your throat is called your uvula. Whenever you're loaded with detox and lack of certain minerals or vitamin, when I tell you to open your mouth and I look inside, if it lean in certain position, I can tell you which vitamin or which mineral is gone. And therefore, for that reason, it get weak and it start to flop. When you remove the toxin, everything, not just the uvula, but many other parts, they become very strong. And I've seen people too who are very weak when their libido is very weak. After detox, they tell you they're strong as a bull. So you will know.
All right. For someone who cannot afford expensive detox products, is there any, home remedy you can recommend, or if
Detox.
possible, show how it's carried out?
Expensive. Well, I'm not sure if I would use the word expensive, or for some people they cannot afford. I've seen people who can't even afford 1 CDs per day. It's unfortunate. But if you are not able to do a detox like what some people would prescribe, like myself, there are things you can do, but you have to understand what you're doing. First of all, you have to understand what you're doing that is causing all this.
True.
And then you have to stop it. Some people not willing to stop anything. They want to eat anything, anyhow, anytime, anywhere. So they don't care to drop that. I'm not talking about that. If the person really want to stop and they want to detox and they don't have the money, there is something, there is something called Epsom salt. They can mix that and drink it and it start to flush them. Or there is a thing called water fasting. You go on pure water. And there's another thing called fruit or vegetable fasting. You can do that as well. But most people, they don't like this, they don't like that and all that. You have to be serious. If you know you really want to get better, you can't say, I don't like vegetables. And because I don't like vegetable, I am not going to do this anyway. You're not going to get anything done. So some of the things, it is best for you to just put aside your differences, how you feel about it, and do it anyway because it's for your own health. Okay. So that's one way of doing it. So, and again, you can go on just fasting. I find that most people find it difficult to fast. If they fast for a day, they call me and they say they feel like they're dying. This is going on, that is, and I'm telling them you're not going to die. And they are asking me, are you sure? So they think if they don't eat for a day, dying, they will surely die. I am telling them, no, you will not die. And it gets so obvious that they're even trying to convince me of they have to wonder, are they really dying the way they sound? But you just have to stop eating heavy food, heavy carbs, meat, everything. Just go on pure fruits, especially orange. Most of the yellow fruit. You have mangoes, pineapple. You go on all these things. Just eat a lot, and it will start cleaning out the inside as well. Could do that.
Okay.
Or vegetables, fresh vegetables. Lettuce, cabbage. All these vegetables. Either you juice it or you steam, and you eat a lot. It come out.
Are there some herbs that you can recommend as well?
Yes. Whenever I'm doing detox, I always make sure that I do detox and applying herbs as much as with minerals or vitamins. So we have, we think we spoke about vitamin C, calcium, magnesium oxide, which can be used to flush you out. And the amount, I think I have already mentioned that in the first one. But as for the herbs, I have always insisted in my practice to use herbs that can both detox, but at the same time, geared up to kill parasites and worms at the same time.
Okay.
Now, I use, for example, when you talk about detox, to clean the blood, kill the parasite, kill the worms, I would use black walnut, which is Juggler nigra. And I love to use the green one, the hulls of the green one. Then, because it have the iodine in it, then we will use Articum lapa, which is known as burdock. And I'm talking the root of the burdock. Then Cascara sagrada, gentian, yellowdock ramex crispus is one of the best herbs for detox in the herbal kingdom. It is so good. It have, unlike Articum lapa, which is burdock have inulin. And then if it depends on what we're doing, we use something called hydrastis, which is golden seal. Most doctors use it for high drop. In most of the high drops you're using, it's really golden seal that they put together, and you're using prescribed as eye drop. Now, the golden seal have insulin, while Articum lapa, which is burdock, have inulin.
Okay.
And when you combine insulin and inulin together, you get a very good purgative reaction, but it also kills worms and parasites like that. But the most interested is also gentian, gentian and sheep sorrow. So, and now, always I would say to put sweet honey. There's a herb called sweet honey. I use that. I use the English name more likely because I want people who, if I use certain name, they may not understand. So they will know it by sweet honey. Okay. They can use that as well. Those kill worm a lot and parasite. Because what you need to know is whenever you're loaded with so much toxin, it leave room, breeding ground, worms and parasite. They like to step in at that time because they have that environment. The fact that you're loaded with toxin, they love the toxic environment. They strives better within it. It is for one reason, I will say that when you have, if your sister or even you, whichever you sleep together, your husband, and you're sleeping together, it's good for you oftentimes to get up at night times, come out of the bed, and stand there over them for at least 10 minutes and listen. You see, it's not that you really want anything, and it's no bad ritual, What you're listening for is, and looking for is the movement in the bed, how they turn. You can tell when there is worm and parasite. The aggressive move. You see some people, whap, 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 and they're doing that. You know it's not right. You listen carefully, and you hear your sister, if it's your husband or whoever that is, you hear them grinding the teeth. And you wonder, you even go close and you look, and you don't see the mouth moving, but you hear the teeth. Those are literally worms and parasites sometimes along with that. What is known to be more worm, but worm oftentimes don't strive without parasite. They always go together. Worm and parasite. Anywhere you find worm, you will generally find there's parasite. Anywhere you've seen parasite, you generally will find that there is worms as well. And it's for one reason why for so many years, cancer, I don't look at it how many people do it. I look at it as kind of parasite and worms that are attacking the body. Mm-hmm. So it's another way, as I said, you have to, you look out for these things. And most of these medicine that I'm talking about, it attacks specifically that kind of an area in the body.
Okay. How often would you advise that a person detoxes their body? How often?
Well, there are no specific because you see, people are different, right? And for me, I believe in doing it 3 times per year. But for someone who are eating very bad every day, the time period they should detox way more than the person who are not eating that badly and living that terrible lifestyle. If you want to live long, you can't be smoking and drinking. And if you're smoking and drinking, you should be detoxing very often to see if you can combat what the ricochet or the side effects from these things be. For example, when you detox, as I said before, is heart, liver, lungs, kidney, endocrine system altogether, included intestine, large, small, and stomach as well. But if you're drinking alcohol, you're damaging your liver specifically, but you're also abrupt and causing serious damage to the pancreas as well. Because whereby the pancreas is to produce certain things like alcohol, it will destroy and damage that as well. So I'm just saying, if you are drinking and you are smoking and you're eating late at night, you're going to your bed and sleep with your stomach heavy with food, then the food stay in your stomach, it never digests properly, and it rotten in the morning. That when you pass your gas, the way it smells, odor, nuisance, you can't even bear your own smell, it's bad. Then, of course, you should be detoxing all the time. With the exception, though, you should be using heavier detox. For example, clay, bentonite. Bentonite draw a lot of toxin from the body, especially for somebody who smoke and drink, or even if they're eating badly and smell like that. If you smell that bad, there is another one which is charcoal, activated charcoal. You take a tablespoonful of that thing, it can't do you anything. It have no side effect. You take a tablespoonful of that into 2 glasses of water, drink it down, and I can assure you, as bad as your stomach is, as stink as you smell, the very next day you can't smell your poo at all. That thing is so good that, in fact, the studies on it has shown that it can pull up to 10 times its weight of toxin. So 1 tablespoon can pull 10 tablespoonful of toxin out of your body. So it's a different way to do it. For everybody, it's different. You accumulate more toxin than I do. You are more toxic than I am. Okay. I may be less toxic because I don't eat these things and I try to live a certain way. I do things that the body keep flushing and moving. Another person, they are so constipated, then yes, they need to flush. They need to clean more often. Okay. So if a person is doing all these bad things, I would say in every week to every 2 weeks, they should do it at a weekend. They should. If a person is doing like what I do, like I just eat certain way, and I don't apply certain things, I don't do things certain way, then 3 times out of a year is good.
Are there any groups of people that should never attempt detox? For example, the pregnant women and those who have pregnant women.
Oh.
And those who have chronic illnesses.
Oh, you mean certain people who are not supposed to do detox?
Yes.
Well, it's not really true. A pregnant woman can do detox.
Any kind of detox?
No, you have to understand. You see, what this confusion is about is what kind of detox you give to this person that you don't give to that one. When a woman is pregnant, you have to be very careful. You give her a thing that is too purgative that she can even end up washing out her baby, which you don't really want. But there are mild sedative detox that when given to anyone, even a pregnant woman, she's okay. It won't do her anything. Okay. There are certain herbs such as yellow dock, burdock. There are certain herbs such as red raspberry. I never go into all these ones. And there are red clover. They clean the blood without doing any form of these. They wouldn't even do anything like that. And then, at the end of the day, somebody check the blood, it's just as clean. it's just as clean. So, no, it's what you're giving. You don't want to give this kind of like a gentane, you don't want to give like even cascara. Cascara is not too bad. You could give it even though it's bitter to the mother. Won't do that. But you have to choose the different medicine to match the person. Like if it's a pregnant mother, you have to take care of what kind you're going to give her. And if it is somebody who is not pregnant, you have to look at which herbs you put in, because there are some herbs that could make you run so much that it could cause a problem with the baby.
Okay.
Yeah.
What are your last words or advice you will give our cherished audience?
To your cherished what?
Audience.
Oh, to my cherished audience. Yeah, that's interesting. Most of you are watching and you're asking yourself, well, you listened to part 1 and now you listen to part 2 of detoxification therapy. Don't get too confused because there is a lot of information that came out. What you want to walk away with from out of this is, 1, you want to live a certain lifestyle. You don't want to end up sick and then you have to be going through detoxification. Live a certain lifestyle that will prevent you from going through these things. Why? Because prevention is better than trying to cure something. Because you never know what might turn up that you may have to fight with to cure it. So if that's what you have to cure, then you have to cure that. It's up to you. We said as a naturopath doctor that I reverse disease, but if you have to cure whatever your problem is. But I reverse it. Now the next thing is, if you're going to use vitamins or mineral, try and consult a good professional, naturopath, who can tell you how many milligram or, how much microgram of this or that you're going to take. Because some mineral can harm you. For example, iron, the kind of iron that they're giving. These synthetic iron, you take too much, it could shock the liver, could cause a problem. And then now, if you're going to use herbs, please be advised that always there are some who practice using these herbs that you're using. If you're not sure, consult a good health practitioner, naturopathic health practitioner, and ask them a few questions and get it right before you start to do it. Okay. Because sometimes you might get frightened with things that you see happening, and you just get scared, and sometimes nothing is even wrong. This guy, we gave them medicine, and when he never used to go to the toilet too often, he was, I would say, severely constipated. And for the week, in one day, he went to the toilet 8 times. And hey, he went nuts. He called and he said, "I'm just coming from the doctor." I said, "What happened? Which doctor?" He went to the hospital. I said, "Why?" "Because I was shitting too much." And then the doctor said to him, "Yes, you're shitting too much." So I just let him know that, look, I take the same thing and I go 25 times. I didn't think it's too much. Because what came out, I didn't want it to remain inside, I want it out. And what is wrong if you're getting it out? I didn't say anything wrong. So, but anyway, he said he felt better afterward and all the rest of that. So, if you consult, do a good consultation before you get into